Prostate cancer. These two words can change a man's life forever. The very words can evoke fear and uncertainty, casting a shadow over the lives of those affected, often whispered in hushed tones, as if speaking them aloud might make the threat more real. It's a disease that predominantly affects men, particularly those over the age of 50, a fact many find hard to confront. The fear of the unknown often keeps men from seeking the help they need. Yet, understanding this adversary is the first step towards overcoming the anxiety it often brings. Knowledge can transform fear into action. Silence only benefits the disease, not the individual. The more we talk about it, the more we can do to prevent it. We're here to break that silence. By opening up the conversation, we can support each other and find strength in numbers. We're going to delve into the world of prostate cancer, exploring its causes, symptoms, and treatments, shedding light on its intricacies in a way that's clear, concise, and easy to understand. We aim to demystify the disease. Think of this as a roadmap, guiding you through the often complex terrain of this disease. Each step we take together brings us closer to clarity. Our goal is simple: empower you with knowledge. With the right information, you can make informed decisions about your health. Knowledge is power, especially when it comes to health. It gives you the confidence to face challenges head-on. By understanding the symptoms, causes, and importance of early detection, we can take proactive steps to protect ourselves. We can arm ourselves with the tools to fight back. Early detection can make a significant difference in outcomes. This isn't about instilling fear, but rather about fostering awareness. Awareness leads to action, and action can save lives. It's about taking control of our health and encouraging the men in our lives to do the same. Together, we can face this silent threat head-on and emerge stronger. Before we delve into the complexities of prostate cancer, let's first understand the role this small gland plays in a man's body. The prostate, often described as walnut-sized, sits nestled below the bladder, surrounding the urethra, the tube responsible for carrying urine out of the body. Don't let its size fool you. This small gland has a big job. The prostate's primary function is to produce a fluid that nourishes and transports sperm. This fluid, combined with sperm from the testicles, forms semen, essential for reproduction. As men age, the prostate can undergo changes, sometimes leading to benign conditions that are not life-threatening. However, in some cases, these changes can lead to the development of prostate cancer. This occurs when cells within the prostate begin to grow uncontrollably, forming a tumor. Understanding the prostate's function and its potential susceptibility to cancerous growth is crucial in comprehending the nature of this disease. Prostate cancer is far from a rare occurrence. In fact, it's one of the most common cancers affecting men globally. Statistics paint a stark picture, revealing the widespread prevalence of this disease. According to the Mayo Clinic, prostate cancer is the second most common cancer in men, surpassed only by skin cancer. The numbers are even more alarming when we consider the lifetime risk. 1 in 9 men will be diagnosed with prostate cancer at some point in their lives. While these statistics might seem daunting, it's important to remember that they don't tell the whole story. Advances in medical technology and early detection methods have significantly improved survival rates for prostate cancer. Many men diagnosed with prostate cancer go on to live long and healthy lives. However, early diagnosis is key to successful treatment and improved outcomes. Prostate cancer is often called a silent killer. This is because in its early stages, it often doesn't present noticeable symptoms. Many men may experience no discomfort or changes in their bodies, making routine screenings even more critical. However, as the cancer progresses, certain warning signs may emerge. Recognizing these early symptoms is crucial in prompting timely medical attention. While these symptoms can also indicate other health issues, it's essential not to dismiss them. When it comes to our health, it's always best to err on the side of caution and seek professional advice. Remember, early detection dramatically increases the chances of successful treatment and recovery. By being vigilant about our bodies and seeking medical attention when we notice any unusual changes, we empower ourselves to take control of our health. One of the most common early symptoms of prostate cancer involves changes in urination. These changes can manifest in various ways, ranging from difficulty starting or stopping urination to a weak or interrupted urine flow. Men may also experience a frequent or urgent need to urinate, often disrupting sleep with nighttime bathroom visits. These urinary changes are often attributed to an enlarged prostate, a condition known as benign prostatic hyperplasia, or BPH, which is common in older men. While BPH is not cancerous, it shares similar symptoms with prostate cancer, making it difficult to distinguish between the two without proper medical evaluation. If you experience any persistent changes in your urinary habits, don't hesitate to consult your doctor. They can conduct the necessary tests to determine the underlying cause and recommend the appropriate course of action. While urinary changes are often the most noticeable early symptoms of prostate cancer, other signs might arise that extend beyond the bathroom. These symptoms can sometimes be overlooked or mistaken for less serious conditions. These symptoms might be subtle at first, gradually increasing in intensity as the cancer progresses. It's important to be vigilant and aware of any changes in your body. It's crucial to pay attention to these signs and not dismiss them as simply part of aging. Early detection can make a significant difference in treatment outcomes. Blood in the urine or semen can be a red flag for prostate cancer. This symptom should never be ignored, as it can indicate a serious underlying issue. This blood may appear pink, red, or brownish in color. Any change in the color of your urine or semen should prompt a visit to your healthcare provider. While blood in the urine can also indicate other conditions like urinary tract infections or kidney stones, it's essential to seek medical advice to rule out any serious underlying causes. Consulting a doctor can help determine the exact cause and ensure that appropriate treatment is started as soon as possible. Additionally, some men with prostate cancer experience pain or discomfort in the pelvic area, which can be a sign that the cancer is affecting nearby tissues, lower back, hips, or upper thighs. This pain can sometimes be mistaken for muscle strain or arthritis, but it's important to consider all possibilities. This pain can range from a dull ache to a sharp stabbing sensation. Keeping track of the pain's intensity and frequency can help your doctor make a more accurate diagnosis. If you experience any persistent pain in these areas, especially if accompanied by other symptoms, consult your doctor promptly. Early intervention can lead to better management and treatment of the condition. As prostate cancer advances, it can spread beyond the prostate gland, affecting nearby tissues and organs. This spread, known as metastasis, can lead to additional symptoms, often more severe and debilitating. Bone pain is a common symptom of metastatic prostate cancer, particularly in the bones of the spine, hips, and pelvis. This bone pain can manifest as persistent aches, tenderness, or stiffness, often worsening at night. In some cases, the cancer can weaken the bones, increasing the risk of fractures. If you experience any unexplained bone pain, especially if you have other risk factors for prostate cancer, consult your doctor immediately. Erectile dysfunction, or ED, can also be a symptom of prostate cancer, although it's more commonly associated with other conditions like stress, anxiety, or heart disease. If you experience persistent ED, especially if accompanied by other symptoms of prostate cancer, talk to your doctor. The key takeaway from understanding the symptoms of prostate cancer is the importance of early detection. While many of these symptoms can be attributed to other, less serious conditions, it's crucial not to ignore them. Early diagnosis significantly improves treatment outcomes and increases the chances of survival. If you experience any of the symptoms discussed, don't hesitate to talk to your doctor. They can assess your individual risk factors, conduct the necessary tests, and provide personalized guidance. Remember, knowledge is power, and taking charge of your health starts with awareness and proactive action. The exact causes of prostate cancer remain somewhat of a medical mystery, but researchers have identified several factors that can significantly increase a man's risk of developing the disease. While we may not have all the answers, understanding these risk factors is crucial in empowering men to make informed decisions about their health. Like many cancers, prostate cancer arises from errors in DNA, the genetic blueprint that controls cell growth and behavior. These errors can instruct prostate cells to multiply uncontrollably, leading to the formation of a tumor. While the root cause of these DNA mutations is not always clear, certain factors can make these errors more likely. Think of it like this. Everyone's DNA has the potential for errors, but certain factors can act like typos in the code, increasing the likelihood of those errors becoming problematic. By understanding these risk factors, we can take steps to minimize our chances of developing prostate cancer. Age is perhaps the most significant risk factor for prostate cancer. The older a man gets, the higher his chances of developing this disease. While prostate cancer can occur in younger men, it's relatively rare. The majority of prostate cancer cases are diagnosed in men over the age of 50, with the risk increasing significantly after age 65. This age-related risk is likely linked to several factors, including the accumulation of DNA damage over time and changes in hormone levels as men age. As men grow older, their testosterone levels gradually decline. This decline can lead to an increase in another hormone called dihydrotestosterone, or DHT, which has been linked to prostate cell growth. This doesn't mean every man over 50 will develop prostate cancer, but it highlights the importance of regular screenings and checkups as men age. Early detection is crucial, especially in older men who are statistically more likely to develop the disease. Section 3. Genetic predisposition, inheritance, and family history. Family history plays a significant role in prostate cancer risk. Men with a father, brother, or son who has had prostate cancer are at a higher risk of developing the disease themselves. This risk increases if multiple family members have been diagnosed, especially if those diagnoses occurred at younger ages. This familial link suggests that inherited genetic mutations can increase susceptibility to prostate cancer. Researchers have identified specific genes that, when altered, can significantly elevate a man's risk. However, it's important to note that most cases of prostate cancer are not directly caused by inherited gene mutations, but rather by a complex interplay of genetic and environmental factors. Having a family history of prostate cancer doesn't guarantee you'll develop the disease, but it does warrant increased vigilance. Men with a family history should talk to their doctor about their individual risk factors and consider starting prostate cancer screenings at an earlier age. Section 4. Lifestyle choices impacting your risk profile. While some risk factors for prostate cancer, like age and family history, are beyond our control, others are influenced by lifestyle choices. Adopting a healthy lifestyle can not only reduce your overall cancer risk, but also promote overall well-being. Diet and exercise are key players in prostate cancer prevention. Studies suggest that a diet rich in fruits, vegetables, and whole grains, coupled with regular physical activity, can lower the risk of developing the disease. Maintaining a healthy weight is also crucial, as obesity has been linked to an increased risk of aggressive prostate cancer. Smoking is another significant risk factor for prostate cancer. Chemicals in cigarette smoke can damage DNA and promote cancer cell growth. Quitting smoking, regardless of how long you've smoked, can significantly reduce your risk of developing various cancers, including prostate cancer. Section 5. The ethnicity equation, understanding variations in risk. Ethnicity also plays a role in prostate cancer risk. African American men have the highest incidence rates of prostate cancer globally, followed by Caucasian men. Asian and Hispanic men have lower rates of the disease. The reasons for these ethnic variations are not fully understood, but they likely involve a complex interplay of genetic, environmental, and socioeconomic factors. Access to healthcare, cultural attitudes towards health screenings, and socioeconomic disparities can all influence prostate cancer risk and outcomes across different ethnic groups. Addressing these disparities is crucial in ensuring equitable access to prevention, early detection, and treatment for all men. Understanding the role of ethnicity in prostate cancer risk underscores the importance of tailored healthcare approaches that consider the unique needs and risk factors of different populations. By addressing these disparities, we can work towards reducing the burden of prostate cancer across all communities. Early detection is the cornerstone of successful prostate cancer treatment. When detected early, prostate cancer is highly treatable, and many men go on to live long, healthy lives. That's why regular screenings are crucial, especially for men over 50 or those with risk factors like family history. Think of screenings as proactive health checks, like getting your car serviced regularly to prevent major breakdowns. Just as a mechanic can spot potential issues before they escalate, screenings can detect prostate cancer in its earliest stages, even before symptoms appear. This early detection allows for timely treatment, often leading to better outcomes. Screenings provide a vital window of opportunity, allowing doctors to catch the disease early when it's most treatable. This early intervention can make a significant difference in a man's prognosis and quality of life. The prostate-specific antigen, or PSA test, is a blood test that measures the level of PSA in the bloodstream. PSA is a protein produced by the prostate gland, and elevated levels can indicate prostate cancer. While not a perfect test, PSA screening remains a valuable tool in the fight against this disease. It's important to note that PSA levels can fluctuate for various reasons, including age, prostate inflammation, and even recent ejaculation. A high PSA level doesn't necessarily mean a man has prostate cancer, it simply warrants further investigation. Your doctor will consider your individual risk factors and medical history when interpreting your PSA results. Think of PSA levels like a thermometer reading. A high temperature might indicate an infection, but it could also be caused by other factors like heat exhaustion. Similarly, a high PSA level warrants attention but requires further investigation to determine the cause. While PSA tests are valuable, they're not the only tool in a doctor's arsenal for detecting prostate cancer. The digital rectal exam, or DRE, is another essential part of prostate cancer screening. During a DRE, a doctor inserts a gloved, lubricated finger into the rectum to feel the prostate gland for any abnormalities, such as lumps or areas of hardness. While some men might find the DRE uncomfortable, it's a quick and relatively painless procedure. This hands-on examination provides valuable information about the prostate's size, shape, and texture, which can help doctors assess the need for further testing. Think of the DRE as a complementary exam that provides a different perspective on prostate health. Combining PSA tests with DREs allows doctors to create a more comprehensive picture, increasing the chances of early detection. Section 4. Navigating the gray zones. When further testing is needed. Prostate cancer screening isn't always black and white. Sometimes test results fall into a gray zone, making it difficult to determine whether further investigation is necessary. This is where the expertise of your doctor comes into play. They'll consider your individual risk factors, medical history, and overall health when interpreting your screening results. If your PSA level is elevated, or your doctor detects any abnormalities during a DRE, they might recommend further testing, such as a biopsy. A biopsy involves taking small tissue samples from the prostate gland for examination under a microscope. While a biopsy might sound daunting, it's the most accurate way to diagnose prostate cancer. Navigating these gray zones can be stressful, but it's essential to remember that not every abnormal screening result leads to a cancer diagnosis. Your doctor is your guide through this process, providing personalized guidance and support every step of the way. Section 5. A shared decision. Weighing the risks and benefits of screening. The decision to undergo prostate cancer screening is a personal one. It's essential to talk to your doctor about the risks and benefits of screening, considering your individual risk factors and preferences. While screenings can detect cancer early, they can also lead to overdiagnosis and overtreatment, potentially causing unnecessary anxiety and side effects. Your doctor can help you understand the potential benefits and drawbacks of screening, empowering you to make an informed decision that aligns with your values and health goals. This shared decision-making process ensures you're an active participant in your healthcare journey. Remember, knowledge is power. By understanding the nuances of prostate cancer screening, you can engage in a meaningful conversation with your doctor and make the best decision for your health and well-being. Throughout this exploration of prostate cancer, we've journeyed through the intricacies of this complex disease, from its often silent beginnings to the importance of proactive screening. Proactive screening is not just a medical recommendation, it's a lifeline that can make a significant difference in outcomes. We've learned that while prostate cancer is a formidable adversary, it's not an insurmountable one. With the right knowledge and timely action, we can face it head-on. Knowledge, armed with early detection, stands as our most powerful defense. Early detection means identifying the disease before it has a chance to spread, giving us a better chance at successful treatment. Remember, early-stage prostate cancer often presents no symptoms, which is why many men may not realize they have it until it's more advanced, making regular screenings even more crucial. These screenings can detect changes in the prostate early on, allowing for timely intervention. Consider them your health insurance policy, a proactive step towards safeguarding your future health. A way to catch the disease in its infancy when treatment is most effective and least invasive. Early treatment options are often less aggressive and have fewer side effects. It's about tilting the odds in your favor, ensuring that you have the best possible chance of a positive outcome. Taking control before the disease takes control of you. By being proactive, you are taking charge of your health and your future. We've also learned that while age and family history play significant roles in determining risk, these are factors we cannot change. Lifestyle choices also hold considerable sway. The choices we make every day can have a profound impact on our health. By embracing a healthy lifestyle, including a balanced diet, regular exercise, and avoiding smoking, we can significantly reduce our risk. You're not just reducing your prostate cancer risk, but also promoting overall well-being. A healthy lifestyle benefits every aspect of your life, from physical health to mental well-being. It's about investing in your health, making choices that will pay off in the long run. One healthy choice at a time. Each small step you take towards a healthier lifestyle is a step towards a brighter, healthier future. Our discussion of prostate cancer wouldn't be complete without a resounding call to action. This isn't about instilling fear, but rather about igniting a spark of awareness, empowering men to take charge of their prostate health. It starts with open communication, with your doctor and with the men in your life. Talk to your doctor about your individual risk factors. Discuss the benefits and limitations of screening, and together, make informed decisions about your health. Encourage the men in your life, fathers, brothers, sons, friends, to do the same. Break the silence surrounding prostate cancer. It thrives in hushed whispers but weakens in the face of open dialogue. Remember, you're not alone in this journey. Countless organizations, healthcare professionals, and support groups are dedicated to providing information, guidance, and a listening ear. Reach out, connect, and tap into the wealth of resources available to you. Facing a prostate cancer diagnosis can be overwhelming, but remember, you don't have to navigate this journey alone. A wealth of support and resources are available to guide you every step of the way, from diagnosis and treatment to survivorship and beyond. Organizations like the American Cancer Society and the Prostate Cancer Foundation offer a lifeline of information, support groups, and financial assistance programs. They can connect you with others who understand the challenges you're facing, providing a sense of community and shared experience. Beyond these organizations, your healthcare team is your constant companion throughout this journey. Your doctor, nurses, and other healthcare providers are your trusted advisors, offering medical expertise, emotional support, and a listening ear. Don't hesitate to ask questions, express your concerns, and seek clarification on any aspect of your care. The landscape of prostate cancer treatment is constantly evolving, with groundbreaking advancements offering new hope and improved outcomes for men diagnosed with the disease. From minimally invasive surgical techniques to targeted therapies that zero in on cancer cells while sparing healthy tissue, the future of prostate cancer treatment is brighter than ever. Researchers are making significant strides in understanding the genetic underpinnings of prostate cancer, paving the way for personalized treatment approaches tailored to an individual's unique tumor profile. Immunotherapy, a revolutionary approach that harnesses the body's own immune system to fight cancer, is also showing promise in treating advanced prostate cancer. While challenges remain, the relentless pursuit of knowledge and innovation in the field of prostate cancer research offers a beacon of hope for men and families facing this disease. With each breakthrough, we move closer to a future where prostate cancer is no longer a source of fear, but a manageable condition.